Okay, we're live. So we're live here with Brittany and Angela. And Brittany has, have you had Botox before?
I have not.
Okay, so our plan is to make your brow lift it up a little bit. And Brittany, go ahead and look in the mirror. And what I notice is that your brow is kind of heavy. This one is a little heavier than this side. And I'm in South Carolina right now where I see a lot of women are overdoing their forehead. She clearly has lines in her forehead, but what happens is that, squeeze your eyes tight like you're pissed off. This is a strong depressor muscle. You can put that down now. This is a strong depressor muscle. Do that one more time. And brings the brow down, and go ahead and wink on this side. That's the depressor muscle as well. So when we weaken the depressor muscles, the forehead automatically starts lifting up the eyes. But if we paralyze the forehead, the frontalis muscle, to get rid of these lines here, the brow slides down. But what I found from doing this for 17 years, tens of thousands of patients, is that if we weaken the muscles that depress the brow, the frontalis lifts your eyes open, and these lines get better without touching them. Frequently, what we'll do as a new patient, we would say, let's just do these muscles that depress your eyes now. Wait 2 full weeks for it to be fully effective. You still might have a line here, and then we might decide to sort of put a little sprinkling of Botox in there. But when the brow is heavy, a lot of times I like to stay totally off the forehead because we want to use that muscle to open your eyes. And you'll look more attractive with a lifted brow and brighter eyes than with a flat, paralyzed forehead. Okay? So go ahead and mark her. So we're going to mark 5 different muscles. Mm-hmm. So the center one is called the procerus. This is depressor supercilii, and that's a corrugator supercilii. So those 5 muscles depress the brow. Now we're going to mark the orbicularis. So the tail of the eyebrow is the first place we shot. And then we're going to do 3 to 4 little injections around the orbicularis. Now these lines down here technically are not depressor muscle. We're softening any possibility of crow's feet. These 2 shots right here will cause the brow to lift. So when I weaken these 2 depressor muscles, the frontalis will lift her up. Let's do it on the other side. So these first 2 marks are depressor muscles, so we're going to weaken those and to lift up the eye, and the other 2 just kind of make it so she doesn't get crow's feet. When we do just the depressor muscles, she'll still want to squint, so these might wind up getting more crow's feet, so that's a little bit preventative. We're going to use 30 units here and 10 per side, so 50 units. And I'm using Xeomin, which is a little bit newer form of a botulinum toxin. So when Botox first came out in the 80s, about 1 out of 7 people would become antibody resistant to it, and they changed it in 1997, where it's much less likelihood to develop antibodies. It still happens, less than 1 out of 100 people. And with Xeomin, they made it with no proteins on it, so it's very clean. It doesn't get any antibody resistance, and it lasts slightly longer and a little bit faster onset. But they both work great. So she's splitting 30 units between the procerus and the depressor supercilii and the corrugator supercilii. The corrugators we give the least amount to. And now she's going to do the orbicularis muscle with 10 per side. It's about 4 right at the tail of the brow. And that allows the brow to lift. And we just diffuse the rest of it to reduce the development of crow's feet and to, again, lift the brow. And this is what I call a Botox brow lift, or in this case, a Xeomin brow lift. I use them interchangeably. They both work pretty much the same way, just slight differences in terms of immunogenicity and duration of effect. So, again, one of her concerns might be the forehead. And if we put Botox in the forehead, it's very easy. Want to grab a 4x4? It's very easy to paralyze the forehead, but then when that happens, her brow will droop. And she already has a droopy brow. Her eyelid skin is touching her eyelash hair right here. And she's 31 years old, and she's already a little droopy. So we want to train her muscles to weaken these muscles and lift up. And what I see is that when people have strong lines on their forehead, the reason they have it is the only way she can see is by raising her brow, so she gets creases there. But if we weaken the muscles that go in the opposite direction, the muscles that depress the brow, she'll get a nice lift to her brow. She'll lift actually right in the mid portion of her brow. She's going to lift the way we tailored this one. And these lines will get softer. She might still have a little line up here. And then in 2 weeks when we recheck her, we'll say, do you like the brow lift? Yes. Well, if you like the brow lift, how much you're willing to give up? If it's nothing, stay the heck off the forehead. I'm working in South Carolina right now. I'm surprised how many people have had their forehead paralyzed. And it's something that, guys like myself have been doing for a long time. We've known to stay off the forehead, especially on a new patient. But I'm seeing people, it's very easy to use small number of units and paralyze the forehead, but it actually drops the brow. I've had a lot of patients that talked about having their brow droopy before, and they didn't know what it was. But if you put Botox here, if you put the same number of units here as here, she would go like this. She would drop down, and it'd be harder for her to see. So thank you very much.